everybody. It's Christine Garvin, and welcome to the 2019 Hormone Summit. I'm so glad that you're here for this tremendous week that we have ahead of us. And this is our first day. And so I'm super excited because we're starting off with something that I think is really, really important. And a lot of times people don't necessarily make the connection between these two things. And that's the health of our skin and our hormones. So these are actually interlinked in a much deeper way than most women realize. And when you just try and work on the skin, a lot of times it doesn't actually get better. So I was really, really excited when I was able to get our today's guest, Brook Venables, who is known as the Clear Skin Coach, which is pretty awesome. And she is a skin and hormone specialist naturopath based in Australia, in Perth. What's great about her is that you don't have to be in Perth to see her. She actually sees clients worldwide because, as we know, this is an issue worldwide, not just in Australia. So what we're going to do today is really dive into what skin and hormone connection is all about. And Brooke is going to tell us lots of good things. So let's jump in. Welcome, Brooke.
Hi, Christine. Thanks so much for having me.
For sure. I'm so glad that you're here.
Yeah, how exciting.
I know, right? It is. It's so fun. So yeah, we're the first interview of the week. So this is
Kicking it off.
I know, right?
Yeah.
Okay, so why don't we get started with just the basics? So acne, I think, tends to be probably the most common skin issue, right? That people probably come to you with, and just people in general, because it's like, oh, it's there, and it starts pretty young for some of us. I know it did for me. So can you tell us a little bit about what the connection is between your, hormones and acne?
Yeah, for sure. So I think, firstly, acne is such a complex, multifaceted condition. So there's a lot at play aside from just your hormones. But I say that with every acne case that I see, there is some level of hormonal involvement for sure. Mm-hmm. So we've got, the interplay of our female sex hormones, which we often see when there are cyclical changes in the skin. So those very commonly known premenstrual breakouts, which a lot of women suffer with. Mm-hmm. Estrogen and progesterone can influence the way that the microbiome in the skin behaves. So that's our protective barrier to prevent infection. And it can also play a role, or both of these hormones can play a role in sebaceous gland activity as well. So fluctuations in oil in the skin throughout the cycle, which a lot of women do notice.
Yeah.
We've also got testosterone at play. So testosterone is hugely involved in sebaceous gland activity as well. Yeah. And something with testosterone I think is really helpful to understand is that it's not just about your level of total testosterone, but what pathway that testosterone is going down. So there's a substrate of testosterone called dihydrotestosterone, which is really intricately involved in acne and sebaceous gland activity.
Interesting.
So that's something that can be tested in a urine test, so when we're looking at metabolites. So that's always something to factor in.
Nice.
We've also got
for that
the Dutch test, absolutely. Yeah, that would be the most comprehensive test to really assess those metabolites and see what pathway is being favored for you with testosterone.
That's awesome. We're going to actually talk later this week more about the Dutch test. So I'm glad that came up.
Oh, brilliant.
Yeah, people are talking a lot about it.
An amazing test. I use it a lot with my clients. Just gives you so much more information to work with on a deeper level. Mm-hmm. So we've also got the role of insulin in the skin. So insulin is your blood sugar regulating hormone, which also plays a role in sebaceous gland activity. I don't know if you've ever heard of acne being termed as the diabetes of the skin, because it is so commonly driven by blood sugar irregularities.
Yeah, that makes sense.
So not only does it increase oil, but it also feeds into hyperkeratinization, which is when you get a lot of dead skin cell buildup on the epidermis of the skin. Okay. So you've got oil, you've got dead skin, that's going to cause congestion, and therefore breakouts. Next, we've got cortisol. So cortisol is that stress hormone involved in fight or flight. And if we're having intense periods of stress or long-term stress exposure, this can really cause more inflammation in the body and the skin. But also it can really deplete your skin's capacity to heal itself. So wound healing is much slower and much more susceptible to things to scarring and blemishes. So yeah, stress is a big one, a really, really big one. Yes.
Always, yeah.
Always.
Can I ask you, can I go back to, that was really interesting about the microbiome of the skin.
Yeah.
I think a lot of people really think about that, right? They think about, I mean, I'd say a lot of people know about the internal, gut microbiome at this point, have at least heard about it, but we don't necessarily understand that there's like all this bacteria on our skin, both good and bad, right?
Yeah, correct. Yeah. So we are covered in microbes, absolutely covered. And a lot of these bacteria are having a positive impact. They're protecting us. So we've got this barrier function in the skin, which is reflective of the microbiome or the barrier function in the gut. So having a balance there with your good bugs and not having too many of your pathogenic bugs, fungi, yeasts overgrowing is going to be really important for prevention of infection.
Oh, that makes sense. Yeah. So I'm guessing that, I don't know if I've seen this, but I feel like I've heard about it, that there's probably some like probiotic face washes out there. Is that
something I'm starting to hear about? Yeah. I know there are definitely some moisturizers that contain pre and probiotics. I think most of it's going to be about changing your internal terrain. There can be some things that are done topically. Internally is most important, but externally we're looking at really reducing those things that are going to be stripping the microbiome as well. So products like benzoyl peroxide are going to be really damaging for that reason. So we want to be supporting that skin barrier function and that microbiome.
So I definitely want to talk more about things that you recommend to your clients in terms of your gut microbiome. But I do have a quick question because it just came into my head, because I actually use like oils, like castor oil and jojoba sometimes, and almond oil for washing my face. Is that a good idea or not?
It's going to depend on your skin type and whether you're prone to congestion and excess oiliness. So for some people, using oil products is going to be quite comedogenic. Other people respond really well. So I think it can be a little bit of trial and error, and working with an esthetician or a dermal therapist to find what's really suitable for you can be the best way to go. It's really individual.
Yeah, that makes sense. Okay, so tell us more about working on our guts and how that, what you need to do in terms of that in order to improve your skin.
Yeah, sure. So we want to have a really healthy looking microbiome where we've got lots of good guys proliferating, and we're getting rid of pathogenic bugs like Candida, Helicobacter. Small intestinal bacterial growth is a big one here, SIBO. I see that a lot with rosacea in particular. So correcting this is, again, it's going to come down to your whys as an individual. So running some testing, working one-on-one with a practitioner, and understanding what your contributing factors are. So it might be dietary, something that you might need to eliminate for a period of time. It could be more of a bacterial or fungi overgrowth that needs to be addressed. And also just feeding that microbiome with all the good stuff. So lots of fibrous veggies, a broad range of vegetables in the diet is going to help to really feed a healthy microbiome. And looking at things like medication, alcohol, sugar, things that can throw that microbiome out of whack. So it's your skin's microbiome is going to be reflective of what's happening in the gut. So it's a really important place to start.
Yeah, that's so fascinating, because I don't think probably many people think that they're going to go to a naturopath or, a functional medicine practitioner, or definitely not just like a regular skin person, and get testing on their gut, So is that something that you kind of do on the early end of things when somebody comes to see you, or do you kind of try and start in some other places first? Like, what should people do in that situation?
If they're experiencing gut dysbiosis?
Yeah. Or
okay.
Have the acne and they're, they may not necessarily understand right off the bat that gut
that it's all connected.
Yeah,
for sure. So looking at their contributing factors again. So what's happening with their diet? What are they consuming otherwise? Is there a lot of alcohol, a lot of sugar? So working on that, removing causes initially is a really important place to start. Gut and hormones are intricately connected. So looking at the Dutch testing can also really help to understand the bigger picture, for instance, or looking at a comprehensive digestive stool analysis can be very helpful too. So looking at the breakdown of your commensal and pathogenic bacteria, yeast, fungi, parasites, and seeing exactly what you're working with. So these are, functional tests that I would implement in individual cases depending on what's going on.
What's happening. That's so cool, because right now I'm in a program and I'm learning how to read the GI map, which is, I don't know if you have that there or not, but similar to the comprehensive digestive stool analysis, just has some other things on it. But it's fascinating, right? And so
it's fascinating.
It's crazy what's going on inside of us. But do you find that the majority of people with, say, bad acne or bad, skin issues do have like fungus or parasites? Is that usually happening?
There's often a link, yes, for sure. And what's going on in the gut is often going to be showing up in the skin. So that there's always something to address there. It's going to be individual for everybody. But I think SIBO in rosacea, Helicobacter in rosacea, Candida in acne can be really common as well. But everyone's going to be individual. So testing is really important to see what you're working with.
Yeah, it's so fascinating to me, because, even just this thought about parasites, like I think a lot of people think if you live in, Australia or America or what have you, in Western Europe, you're not going to face having parasites. And the reality is most of us do, right? We have the world is a small place now. We're all traveling and spreading everything around. So all these things happening inside that we really don't necessarily realize. And then I'm sure that this is the thing that you see with your clients is like, once you figure out that they have these things, like it's not just about their skin improving, right? There's all these other aspects.
Absolutely. And when you're treating skin, you're treating it holistically and from the foundations up, you're treating the whole body. So you're going to see everything else improve along the way. Your skin is often the last thing to heal, and it's the first thing to show up. So you have to work through those layers.
I mean, I know that it's really hard to say because it's so individual, but how long do you, tend to maybe tell your patients, like, if it's going to take maybe, I don't know, 3 to 6 months, or how long should people think about, okay, when I'm trying to heal my skin, it's going to take this amount of time to do?
Yeah, sure. Again, really, really individual. I think results can be seen physically really early on when appropriate changes are made. However, true healing and resolution takes time. And when you're working through those layers. So it's going to take some time to really get to that point where your skin is really resilient and you're not going to fall back into those old patterns. So your skin cells turn over completely around every 28 days or so. Sorry, what was that?
Like our cycles. Like our
yes.
cycle.
Yeah. So you want to be really influencing all that new skin cell growth, and to be able to see those visible changes. So covering 3 skin cycles is probably the minimum time frame you're wanting to look at. Even if you start to see changes earlier than that, you want to be really influencing those new little baby cells that are coming up from the inside that are going to start to show on the epidermis eventually.
I'm glad that you said that, because I think this happens a lot, not just with skin, but just in our health in general. We'll make some changes, and a lot of the diets out there are 3 weeks or 30 days or what have you, and people are like, yeah, I feel amazing, and then they go right back to what they were doing before,
They get complacent.
Right. It's like, oh, I healed, or I did my 30 days, and the reality is that's just the beginning, right? And that's
absolutely
make those permanent.
Yeah, I think with any sort of chronic condition like acne, it's been manifesting internally with these imbalances that are contributing for quite some time before it shows up in the skin. And often I'm seeing women that have been struggling with it for a long time, and I'm their last port of call. They've been through Accutane and antibiotics and the pill, and there's a lot to unravel. There's a lot of healing that needs to be done to really resolve it for good.
I bet. So that just made me think about, I started having acne when I was, 12, 13, and so what is happening then? Obviously you're, going through puberty and all the hormones are crazy, but can you tell me kind of specifically what's going on at that point?
So yeah, you've got it right there. It's there's fluctuations in hormones that are somewhat out of our control, because that's just part of puberty. However, I think that there's still a lot that can be done around that time to help to control, even though we're wanting to let your hormones do what they do. But what's really helpful to know is that your hormones are constantly responding, no matter what age you are, to your environment, what you eat, what you do, and even how you think. So there is a lot that can be done to influence the way that your hormones behave. And that goes for teenagers as well. So, what they're eating, how they're exercising, are they sleeping, all of those things factor into play.
And I'm glad that we, came to that place, because I think there's probably going to be a lot of women listening to this who have daughters who are nearing that age or already in that, and, feeling frustrations around that. So I think the fact that they can know that there are some possibilities and some outlets. It's not just like, okay, I'm gonna have this skin for 10 years or whatever,
Yeah. It's not something that has to be put up with. It's a sign from the body that something is out of balance. And it's like a red flag saying, some attention needs to be paid here. We're going to do something about it. So it's a really clever thing by the body, really, to let us know that something needs to be done.
You're like, thanks, body.
It could be done a little more subtly, but yeah, we can be grateful for it all the same.
Can we circle back to when you brought up stress? Because I think this is an important thing that, we're hearing more about the impact of stress on particularly women's bodies. Obviously it affects men too, but it has even kind of more of a detrimental effect on us, I think, because of our hormones. So I'd love to hear some more so that women really kind of understand, like, okay, how does stress, throw everything off?
Yeah, absolutely. So Look, I think when we're in a fight or flight mode all the time, so when our stress hormones are elevated and we're hyper responsive to stress, it's causing the blood flow to go to your limbs in that primal fight or flight response, and that is redirecting energy and nutrient supply and blood supply from digestive function, from reproductive function. So it's going to impact everything in the body, basically. Our cortisol can be quite inflammatory when it's in overdrive. So that can really impact the skin in particular. It can deplete your skin immunity, like we mentioned before. But I think the biggest one with hormones is that when stress is in overdrive, it redirects the resources that we need to make progesterone, and sometimes even to ovulate consistently. So when the body perceives stress, what can happen is a shutdown of ovulation, because the body doesn't feel safe to procreate or bring a baby into the world if it's perceiving that there is famine or danger. So sometimes we won't ovulate when we've had an intense period of stress. And we need to ovulate to produce all that beautiful progesterone, which I like to call the happy, relaxed, clear skin hormone, which we can't get enough of, basically. And stress plays a huge role there in depleting your progesterone by impacting ovulation a lot of the time. It also depletes you of a lot of nutrients. So it takes a lot of stores to ramp up your adrenaline and your cortisol in a stress response. So B vitamins, vitamin C, magnesium, all can be depleted, and they're all the things we need for nourishing our nervous system as well. So many different ways that stress can impact the body, and it's fundamental to all healing, really, is getting control of that stress response. It's the first thing that needs to be addressed, in my opinion.
Yeah, I mean, I know we talked about this a lot in our apprenticeship with Nicole Jardine, but it's so many things that happen throughout the day that I think people don't even think about being stressed, that's a stressful state, like even just having, the TV on or being on your phone late into the night or even late into the evening, the impact of blue light on us, having that, lights on, what have you, till 10 o'clock, 11 o'clock at night, not going to bed until later. So many things. And then, not having a concrete time that you set aside in your day, where you're like, okay, I'm getting out of my fight or flight response. I'm going to get into my parasympathetic so that the repair and the rest and everything can happen. And
so important,
valued, right, in our society. And unfortunately, women's bodies are even more impacted by it. And then we have to do everything too, right? Be the every woman. So
you're absolutely right. Yeah.
Is that something when clients first come to you that they have never really thought about the connection between stress and skin?
A lot of them do notice that they get breakouts when they are stressed. But I think the biggest thing with stress that a lot of people aren't aware of is your physical stresses as well as your emotional stresses. So I think it's easy to think stress is just emotional. It's how I'm thinking, it's how I'm feeling, it's how I'm responding. But it's also those physical stresses that you just mentioned. So artificial light exposure, too much high intensity exercise, not getting enough sleep or quality sleep, and this electromagnetic radiation and blue light that we're hyper exposed to. So I think it's really important to understand that stresses on the body are physical as well as emotional or mental.
Yeah, for sure. So like I, mentioned in the beginning, I figure that acne is probably the most common skin condition that you see, but what are some other ones that people come with?
Yeah, so rosacea was something that we chatted about because we've both suffered with rosacea, so I understand the struggle there. I've run the full gamut, acne and rosacea in my 20s.
Yay!
So yeah, I get it. Eczema and psoriasis are skin conditions that have dealt with a lot in the past. I think with all skin conditions, we always come back to that skin barrier function. So no matter what the condition is, if there is inflammation, there's dehydration, or there's infection, we know that there's a compromised skin barrier function. So improving that microbiome, helping with that healing and repair of that stratum corneum is really important for addressing anything inflammatory in the skin.
And I've heard sometimes that like eczema and psoriasis are considered autoimmune. Is that true, or is that just kind of?
I'd say the jury's out on that one. I see eczema shift really, really rapidly by treating the gut and improving omega-3 status. So high dose omega-3 and often certain probiotics for the gut microbiome and stabilizing secretory IgA, so your immune system from the gut. So yeah, I see it shift very quickly with nutritional changes as well as help with gut health. Psoriasis, I believe, probably does have more of an autoimmune component. But essentially, dermatitis, eczema, psoriasis, we are dealing with a very similar presentation. And we're looking at restoring and repairing and then correcting nutritional deficiencies in gut function.
Well, I do love hearing that, because I think sometimes people think, God, there's no answer here. And I have this thing that some other people have that nobody's been able to find a cure. And, you're kind of saying, well, at root, the root cause is very similar for all of these different skin ailments, and so it's like people can heal it. They can,
absolutely.
Yeah.
There is always a why, and once the whys are understood and addressed, you can start that healing process for sure.
So just one more question I was wondering about. Do you see, as women age, that they have to deal with different issues with their skin because of the hormonal changes that they start to go through?
Yeah, definitely. So as we hit perimenopause and progesterone and estrogen starts to decline, one really big factor there is a decline in collagen and elastins. So the skin's ability to heal and repair, and we tend to get more crepiness in the skin, more sagging, loss of elasticity. So that's one way that those hormonal changes can impact the skin. And like we mentioned before, estrogen and progesterone do have a role to play in the skin microbiome. So as they deplete throughout menopause, I often see more of that rosacea type skin come up. So that alteration in the microbiome. So yeah, collagen would be a big one, and the microbiome of being affected by that hormone depletion. I think the biggest thing when we're a little bit younger is prevention. And so adopting a low GI diet can be really, really helpful in preventing glycation, which is that premature breakdown of collagen. So we can start a little earlier to implement some changes that can prepare our skin for that change as the hormones change.
Oh, that's
vitamin C would be another thing as well. So We make collagen from vitamin C, so that's something that can be implemented either through diet or supplementation to support collagen synthesis.
So I have to ask the question because it's such a big thing in the marketplace nowadays. And, I've heard that it doesn't actually help our collagen production, but we can buy collagen, supplements all over the place these days. Does our body actually use that and make collagen out of it?
So if it's hydrolyzed, it's going to be absorbed by the gut a lot better.
Okay.
So you want to always look for hydrolyzed and quality that doesn't have a whole lot of other ingredients in there. So just pure collagen. We want it to be grass-fed and organic if possible as well. So we're getting the best possible nutrition out of that. So yes, if it is hydrolyzed, it will be utilized by the body. There is no replacement for your body's natural production of collagen, but we can certainly help to supplement and improve skin tone and texture and gut health as well through taking a supplement.
Yeah, that's when I've I've gotten samples here and there, and I tend to think of it more as like, okay, I know it's helping my gut, it's a good gut healing thing. I don't know if it's actually helping the collagen in my skin, so. Yeah,
well, it's all connected. So I think if you have a good quality one, you're absorbing it correctly, then you can see some good impact from that. Yeah.
One other thing that I wanted to ask you about, because I've noticed on Instagram, you work with an esthetician. Is that true that you guys?
Yeah, correct. Yeah. So I have worked alongside dermal therapists in Perth over the last 8 years or so. And since taking my business online and working worldwide, I have aligned myself with some really amazing estheticians and dermal therapists around Australia, but I've also got a couple in the States as well.
That's so cool.
Yeah, it's so great. It just makes so much sense to work externally and internally. You're tackling both angles. So we'll work quite closely on a client with acne and address it from both angles, hit it hard and fast.
Yeah.
So they will do things that I can't do, and I do things that they can't do. So it's a really great partnership to be working together.
Yeah, I think that's really incredible. I thought that was so cool when I, noticed that your posts on Instagram that was talking about that, about one particular woman, I think. And I just was like, oh man, every esthetician, at least, I feel like should work with a naturopath or, someone that can work on gut health. But I think it's great that you, especially since you see people worldwide, that you're, having these connections for them to get that. Because it's nice too to see an esthetician, usually, to also just have somebody take care of your skin, right? Like you're like, okay, I'll do the internal stuff, but it's nice to go get some external
definitely. And it's all part of that stress management as well, isn't it? Taking that self-care.
Yes, it's a win-win-win. I like it.
Yeah, you're right.
Well, I could ask you a million more questions because there's just so many things that popped in my head. But we're gonna wrap it up. We've had such an amazing time today. I've had such an amazing time talking to Brooke, and I hope that you have had too, and have learned so much. I know I have. I mean, it's just so incredible to me. Even though I know holistically everything's connected, it's still really cool to hear the specifics of all those things. So I hope that you learned a lot today. And Brooke, tell us how people can get in touch with you.
Sure. So my website is www.clearskincoach.co or Instagram, which is where I spend a lot of my time, is clear_skin_coach. So that's probably where most of my content you'll find. So people can email or DM and get in touch if they're interested in working with me one-on-one.
Cool. Yeah, I definitely recommend following her on Instagram because I love it. I'm always like, oh, what's going on? Let me see how this is now.
Thank you.
For sure. So thank you so much for being with me here today. I really appreciate it.
Thanks, Christine. It's been an honor. I've been really happy to be a part of it.
Great. All right, you guys, we will see you tomorrow for the next interview in the 2019 Hormone Summit. See you then. Bye.